The Ministry of Health and Wellness has shifted its approach to combating COVID-19 in response to community transmission phase of the pandemic. Portfolio Minister Dr. Christopher TUFTON said the shift is in keeping with standard recommendations from the World Health Organization. Melvin Pennant has the details.
In his weekly COVID conversation press conference on Thursday, the health minister said, with the island now in the community transmission phase of the virus, the government is moving towards getting Jamaicans to live with the pandemic. He also announced changes to how the information is disseminated.
As of tomorrow, Friday, September 11th, for example, as a first specific point, the update on the COVID-19 numbers will be provided by 10 a.m. each day, reflecting the verified numbers of the last 24 hours. Access to those numbers will be provided through our website, that is www.moh.gov.jm. So the Ministry of Health and Wellness's website, www.moh.gov.jm, and the link to those numbers will be provided on our social media platforms, which is at the moh.gov.jm. So every day, 10 a.m., we will upload the latest numbers on the website. So all who wants to see and get an update can visit the website. Our weekly press conferences and COVID conversations will continue during this phase, providing members of the media the chance to get behind the numbers while giving the public a better understanding of what they need to do to keep themselves safe while slowing transmission.
Targeted approach or community intervention. Dr. TUFTON says the ministry is currently consulting with critical stakeholders to finalize the shape that this management will take.
As part of this new approach in this phase, we will over the next week, and as minister or recently appointed minister, the team and I have been consulting with a range of stakeholders over the last number of days, and we'll continue that into the next week as we seek to concretize a comprehensive plan that will represent the specifics of the shift in the approach to managing COVID under the community transmission phase. This will include testing protocols and the shifts that will take place there, the workplace protocols, the communication and public education, the clinical management, the infection prevention and control protocols, ports of entry management, the community intervention, and what we are doing now is, as said earlier, is consulting with stakeholders to sign off on these new approaches, helping those critical stakeholders to understand what the shift represents and why it is necessary.
With the country now experiencing a large outbreak of cases, more shifts in the management of the virus may be required as the numbers go up. Melvin Pennant, PBCJ News.